Rebecca here from the Premium Private Practice Mastermind. I am a registered dietitian turned business coach for health professionals in private practice to help them start and scale their digital private practice online. And today I want to talk about two clients in two countries and now two government-backed health programs. So what if I told you that my clients in two countries just received government and innovation funding for their health programs and protocols that we created in the mastermind? These aren't public health researchers. These are private health practitioners just like you who transitioned from that hourly rate traditional consult into delivering clinical protocols and programs online. And now their work is being backed on a national level. So this is huge. Why this matters, not just for them, but for all of us who are really building healthcare, ethical healthcare programs online that are evidence-based, client-focused, ethically designed and priced, and designed to deliver better outcomes than traditional consults alone. This is super important because government funding and innovation funds aren't just easy to get. There is a huge process that they had to go through to get this. So if these programs are getting the green light, it to me says one thing very clearly. What we're doing is not only clinically sound and really profitable and fantastic from a business point of view, it's the future of healthcare. And it's been a huge validation to say what we're doing is not just profitable, but ethical. Now, I know shifting for a lot of health professionals from hourly rate consults to a structured protocol or program can really feel uncomfortable. You might be thinking, is this really ethical? Will clients go for it? Isn't this what I already do in consults anyway? What if it doesn't work or it takes too much time? So instead, we revert back to consults so easily. And I see this as a trap all the time. Even if we've designed a program or a protocol, we tend to go back to hourly rate consults because there's a little something in our brains that is basically telling us that this isn't okay, even when they're burning us out and we're seeing I've seen 15 clients a day in a practice, and it doesn't really provide us with the freedom and flexibility we need. What these clinicians have done is the difference is inside the Premium Private Practice Mastermind, we don't just take what you're doing and turn it into a 12-week program or slap a high price tag on it or package it and call it a program. We really dive deep and we design evidence-based, protocol-driven solutions that are intentionally designed, built around your expertise, your clinical niche, and real clinical rationale. And that's what I really want to talk about today is that when it comes to healthcare, business is a little bit different. And when practitioners are jumping online to sell this, if they're not feeling really confident that it's ethical, it's going to get patients amazing results, we tend to pull back from our marketing and not feel as confident and have enough conviction in order to sell it, in order to enroll people to help them. So these two programs, I was just reviewing them, and there's a few trends that came up, similarities in the two that allowed them to get to the stage, even though the programs are thousands of dollars per person, why they receive these innovation and government grants. And I want to go through some of the trends so that you can hopefully start applying this in your own healthcare business today as well. Number one is that they were fully delivered digitally. One of them in particular was a very traditional hands-on area of care where we're taught that physical therapy you need to go to someone's house, or they need to come to a clinic. And we actually moved this program completely online into the digital healthcare setting, which was a bit of work to begin with to readjust basically the systems. But what it allowed us to do is to reach people nationally and really reduce the number of hours that practitioner had to go in. But we had to do it in a very specific way where the client outcomes weren't reduced because they weren't necessarily getting all the hands-on therapy that they were previously used to. And I'm really happy to report that one of them specifically, not only have we moved it online so she can now treat a wider audience on a national level, rather than the 2 to 10K kilometers that we've previously been designated to with brick and mortar clinics and hands-on therapy, it's actually getting her clients and her patients better results because it's more accessible. And sometimes we have a hybrid one where there's hands-on and digital, but there's definitely a way forward for most people. The second thing is structured clinical frameworks. So we're using protocols with clear assessment points, retesting, and personalized pathways. This is essential rather than just the traditional way of working, which is turning up to a consult, hear how you're going, give the next bit of education, come back in a few weeks, we'll see how you're going. We're really restructured their clinical expertise and the pathway of how they get patients and clients clear results into a framework that is repeatable and therefore scalable and also easy to communicate to patients and clients. They're more happy to invest because they can see where they're going, that there's a plan as opposed to just winging it consult by consult. Now, all practitioners already work in this way. It's usually just bottled up into their heads. So this is where we use things like the protocol bot builder as a start. And I sit with clients for a full day in person to really pull out their clinical process so that we can communicate it and make their full program in terms of delivery much more streamlined. If you want access to that protocol builder bot, I'm happy to give that to you for free. Just message me, comment below, depending on where you're seeing this for that, and I'll send it your way. So the third thing is that it's not just evidence informed, but evidence and research justified. So what I mean by this is sometimes when practitioners build programs, or how we're taught in the business world, is more is better. And we just add stuff in for the sake of it, typically to make ourselves feel better for charging more. We're saying, I'll just add more in to make it look better and justify the higher price. But that's really not the route that we take in the Premium Private Practice Mastermind. Every inclusion has been added intentionally. It has a clinical rationale. And if we can't clearly describe why it's there or how it's going to benefit the patient or the client to get them results in a shorter amount of time, or increase the likelihood of them getting results, then it's not allowed in the program. Whether this comes down to clinical rationale around hormone cycles, iron absorption timelines, pathology windows, whatever it is, we really base, for example, how long the program is based off the research. Let me give you an example. One of my clients is working in the fertility niche, and we were wondering how long her program should be. So typically we say, it could be, it could be 2 months, it could be 3 months, it could be 6 months. They need a lot of time working with me. But that's not a clinical rationale. What do we actually know in the research about hormones and cycles, for example? We know that once they've got a clinical protocol, it takes about 3 period cycles in order for us to start seeing a result. And after about 3 cycles, that's where we can retest the hormone levels again to see how they've changed and then pivot the clinical recommendations at that point. So based off that as one justification for the program length, we obviously need it to be at least 4 or 5 months to allow for the testing to begin with, the implementation of the protocol that's personalized to that patient or client once they've started implementing the protocol, and then a retest phase, allowing for the test to come back and us to personalize and pivot again. So that is why it's that long, and it's going to put you in a really confident position when you're speaking to prospective clients and patients who may ask you questions like, hey, can I just do a one-off consult? And I don't want you to just do a one-off and then you need to come back 6 months or a year later. Let's do it once, do it right, and actually go through the full testing, implementation, retesting cycle so we know you're set up and you no longer need me. And over the scale of the timeline, this is how people are actually saving money rather than every year going to a sporadic 3 to 5 consults with a practitioner when the same problems keep coming back. Okay, number 4 is cultural relevance. So the reason these health practitioners were able to access government and innovation grant funding is because they deeply aligned the programs with the client's backgrounds, identity, and needs. So as I mentioned, this has happened in 2 different countries now. So the culture of that country, specifically the Indigenous culture, was really brought into both of these program designs, which I think is really, really important. The next one is they were data ready. So both of these programs were built with a plan to actually measure outcomes and track efficacy and then iterate. So rather than a lot of practitioners, purely just because they don't have time, will create a plan and then just based off subjective data, asking the patient how they're going, how they're feeling, pivot the program as it goes. But we're in such an exciting time in private practice world where we've got so many tools available to us in order to actually track the outcomes of healthcare through wearables. I've got multiple on today, through gamification, through testing, through pathology and data collection on digital dashboards, that we can actually track the efficacy so that we can actually get more funding for these programs, but also with each individual patient or client, get them results faster because we can pivot based off the real-time data that's actually coming in. So we've got a baseline protocol, but if it's not working for that person, we'll know straight away and or what they need to prioritize. Because if we've got a sleep protocol, for example, as part of perimenopause program, and we can see that they're not sleeping because they've given the consent to give us access to their wearable data, we can really focus in on that, because there's no point eating perfectly if you're only sleeping 4 hours a night. It's really going to undo everything. So we really focus our training around that, for example. Okay, the next one is personalized care. Neither of these programs were cookie cutter or generic. So this is my gripe with a lot of online courses and self-paced courses. They absolutely have their place in time, but when it comes to getting the best patient results, population-based advice can only get people so far, and it's a bit slower. It's kind of like, we've got the evidence, it's going to get you so far, but from after that, it's very much trial and error. We're throwing spaghetti at the wall to see what sticks, what works for you, and hoping for the best, and then pivoting afterwards. Whereas with personalized care, when we do include things I've alluded to before, wearable data, pathology, DEXA scans, clinical interviews, and other physical assessments and functional testing, we can actually get them to their personalized protocol from the start, which is going to speed up results and make the customer, the patient, the client feel much more prioritized and taken care of from the get-go. Again, leaning into that value of ours is like, do it once, do it right, rather than just ongoing bits and pieces through care. The next one is that it was scalable. So both of these practitioners who received government funding and innovation funding was because they're virtual and because they are personalized at the front end and because they rely on protocols as opposed to just hourly rate, hourly consult, evenly, weekly, or fortnightly or monthly, is that there's always going to be a bottleneck for that traditional way of working. But because they employed these other methods, they can be deployed at a national scale, not just in that 10-kilometer clinic radius, but also we can take on more and more patients and clients because we're using these digital tools to actually coach people along the way and make it personalized from the get-go. The next one is time leverage. So both clients now spend actually less time, which links into the scalable element, per patient, but actually getting them better results. This is a huge thing. So particularly one of these clinicians is going through a transition phase in her business where she came to me where she actually has a full clinic load booked out with patients and clients. And at the same time, she knows that there's a bottleneck with that business model. So we built her program on top of it. So she's built it and is selling it at the same time. And it is a tricky transition phase because we need to slowly decrease the amount of hourly rate consults and slowly increase the number of protocols and program sales simultaneously. Now, what's been really interesting is she's sort of halfway there where she's still sorting through so that we don't just leave people unsupported. But she's found that even though this program is higher priced, it's actually getting her patients and clients, better results. And it's also taking her significantly less time than the traditional way of working. This is the epitome of what we go for and what we're aiming for in the Premium Private Practice Mastermind is a win-win for everyone. Clinical results and freedom and flexibility and leverage for the practitioner. And at the end of the day, that actually allows her to have a bigger impact because half her schedule's freed up so she can actually work with more patients and clients. So none of these are self-paced, passive health content. As I mentioned, all personalized, protocol-driven, and ready to scale. So I hope that's helpful. Fully digital, structured clinical frameworks, not just evidence informed, but evidence justified. There's cultural relevance, they're data driven, there's personalized care, they're scalable, and they're time leveraged. And the reason that this matters more than ever right now for health professionals in private practice is as tools like Function Health by Dr. Mark Hyman and superpower.com push functional data straight into the hands of consumers, this is really your moment. This is what people are, I suppose the market is actually asking for right now, but they're not always focused on the practitioner. So those health professionals who step into leadership with structured, personalized, ethical programs that leverage the tools that superpower.com and Function Health do as well, while also providing that practitioner access, are really going to stand out and serve more people without burning out themselves as well. So this time is now. So if you're a health practitioner, I hope this has really helped. A bit of a summary. If you have any questions, I'd be more than happy to answer them. But if you're a health practitioner who really wants to streamline your business, reduce client load, and increase both your income and your clinical impact ethically, and create programs that are really scalable, really profitable, but so good that the government and innovation funds are wanting to put money behind you as well, I'd love to invite you to a free strategy call. No pitch, no pressure. We'll look at where your time is being wasted in your business, how to build a scalable model that works for you in your clinical start, for your clinical niche, and how to make your offer so compelling and so ethical that it could actually be funded as well. If we're a good fit to work together, I can talk you through that too. But either way, you'll walk away with clarity, a path forward, and confidence to lead the next wave of your private practice health career. So lovely having you here, and I will talk to you more soon.